We're live.
Hey guys, it's Dr. Emer, and we're just doing one of our favorite female anti-aging treatments, which is neuromodulation or Botox injections. These just stop the movement lines. And you guys, the thing is, movement lines create wrinkles. And I love my wrinkles, so it doesn't bother me, but some people it really bothers them. Plus, it allows you to get nice arches to the brow. And my one patient really likes having her brows lifted. We've already done a little bit of filler through this area, and she looks amazing, especially for being an athlete. Athletes tend to metabolize fillers really quickly and lose facial volume, so she has nice lift. We just want to prevent wrinkles from forming on her forehead, around her eyes, between her brows. So squeeze in, show them you being mean and mad. Good, perfect. You can see what happens when she gets mad, although she's a very happy person. You can start to get wrinkles. Raise up as high as you can. You can see across the forehead, the frontalis muscle, producing these fine wrinkles, and again, smile as big as you can, minimal fine lines right here. So we're gonna prevent those. The one thing I always tell people is it's nice to be a little more conservative on the forehead so you don't droop the brow. The problem is if you do that conservative approach, it only lasts about 6 to 8 weeks. So in her case, I'm actually gonna do a little bit stronger on her forehead, which will make her a little more, quote, frozen. But because she's an athlete, you guys, she tends to metabolize more quickly. I want it to last longer. So this will at least last for her 2.5, 3 months because we're gonna do a little bit stronger of a dose. So squeeze in again, show everyone you're getting mad. So we're gonna grab that complex right here called the glabellar complex, and we're gonna inject first the procerus muscle. We're gonna go nice and slow, do a small injection, feels like a little bee sting. Squeeze in again, relax. We're gonna grab that muscle, go right into the muscle, squeeze right there. Perfect, relax a second. Go ahead again, squeeze in, relax, perfect, grabbing that muscle. Are they saying anything, guys?
They're asking, so why does it bubble?
So this is fluid. This is the fluid being injected with the neurotoxin. And again, that is gonna go down like a bee sting. It'll go down in just an hour, maybe even less. And so we're gonna basically customize where we inject. So she has more of a V-shaped glabellar complex squeeze in. So you can see it all goes like this. So we're gonna follow that V shape. We're then gonna do a small amount on the forehead. So raise up again. Now, I like to keep her having a nice arch, but if you go more to midline, this is gonna arch away too much. It's gonna like this. So relax, raise up again. Good, relax, perfect. So we're just gonna do a small amount, a little bit on the tail. Raise up again, relax. We're gonna go a little bit high, small amount. I call this baby tox. So we do just little doses to just keep it nice and even.
How long does Botox last?
Well, that's what we just said, you guys. We said, and normally, if you do a small amount, it depends on the area, but typically it would last you about 2 to 3 months. But in someone that works out so much and exercises, they metabolize this a little quickly. You don't have to show that, you can show her. It metabolizes quickly, and so we might want to do a little bit extra in those patients to make it last longer. Smile as big as you can, relax. But this is a good timing that when you get your Botox, you come in and you get your facial, you get a little laser at the same time, because every 2 to 3 months you really need good upkeep. Go a little to the tail of the brow here, that'll give her a little lift. And then smile again as big as you can. You see she extends down a little bit here, she's recruiting. So let's go to a little bit of the lower section. Perfect, now we're gonna go to the opposite side. Turn your head that way for me, smile as big as you can. Again, going all the way down this orbicularis muscle. We're gonna go right here in the center. In the old days, we used to do one bleb. I called it the matzo ball technique. You smash it down and it goes all the way around. You could still do that. That's because I did my training in New York. So that's why we called it matzo ball. And now, just do a little bleb. We customize it. So that's a perfect. That should give her just a slight, more improvement in the center, just a slight reduction on the side so we don't get hyper elevation, because we don't want that. That looks like a Spock effect, and we don't want that. And no. She's gonna come back in the next couple weeks, and she'll show you guys the result. It takes about 10 to 14 days to truly kick in, and about 3 to 7 days. You might notice a little irregular, it might not be perfect, but again, you gotta wait that 10 to 14 days. Was it painful?
Nope.
Okay, so she was emerized. Have a good day, guys.
Perfect.
Great.
Thank you.
Okay, so I'll see you in 2 weeks.
Yep, I'll be here. And
If
what
I-
do you
We'll
filler?
do filler, and if I have the new threads for the